Good morning. I'm Dr. Pelliccio. Thanks for having me. I wanted to present a topic today, a topic I've been working on for the past 2 years or so, entitled Electromagnetic Induction Heating of Composite Mesh and the Treatment of Mesh Infections. And I'd like to thank Dr. Alexander for the use of his lab and 3D printers to help this happen. I have no disclosures. So just to define the problem, as y'all are aware that with implantation of non-absorbable mesh, there is a risk of mesh infections. This chart here is 6 different retrospective studies, with the N on the top line being the total number of patients that were examined, the number of meshes that were infected. The next is the number that were cleared using conservative measures, meaning antibiotics, incision and drainage, anything that did not include actually excising this mesh. And then the last one is being excised. And then I took an average of each of these. It's around a 4% overall mesh infection with almost a 40% rate of excision of mesh. So how can you address this problem? And what my thought here is maybe you could use heat. When it's implanted in the body, the idea of heating non-contact would be ideal. Before I play this video, this is an inductive heater, actually kind of in my living room, playing around with this when I first started. It's a water-cooled coil. It's the cap of a 50 ml conical vial, and that's a 1 by 1 centimeter piece of mesh that's been electroplated with a very thin layer of iron. This is a real-time video. That's an infrared thermometer. I was just testing to see how well it heats. I'm putting about 3 watts of energy into this. That's in so it fairly rapidly heats. That's 120 Celsius right there. You can go as high and even turn that into like a puddle of plastic if you wanted to. So what we did, we took Heart Agar. These are a bunch of the meshes that we created. We incubated them after inoculating with Staph aureus for 24 hours at 37 Celsius. We then took each of these, vortexed it in 2 mils of phosphate buffered saline, and then serially diluted again with phosphate buffered saline to a concentration of 10 to the -6. We took these and plated them. I did 2 completely separate tests, and what I mean by that is I made new meshes for each of these. 1 and 3 are the first set of tests, 2 and 4 is with another set of electroplated test pieces. These are the reductions here. That's -1, -2, and so on to -6 log. And overall, when looking at these and doing colony counts, they are actually quite similar in outcomes. This is the reproducibility, just an example of the 50 to 60 degrees Celsius blocks, fewer colonies in these higher dilutions. And then another just to show the 80 to 90 Celsius, these blue boxes here. You have growth into the -4 log concentration. There's 1 colony in the -5 on this one, but overall fairly similar. Here's an actual visual representation after incubation. This is after 24 hours. Light microscopy at 200 times magnification. This is some of the staph colonies and maybe some of the agar as well. This is after heating, but prior to centrifuging to show you the effect of heating alone. So there's quite a big visual difference as well. Overall, this is the results that I've done with the number of meshes I've tested at the time of the abstract. With control 9, this is the mean number of colony-forming units amongst all the controls. And then I compare the percentage of viable bacteria that we plated out as opposed to our control. This is the log reduction, and get a better visualization. This is the % reduction in the total bacterial load. So quite a big difference once you get near 100 Celsius, even in the 80 to 90 Celsius groups. And again, these are all heated for 10 minutes. So again, just to repeat the conclusion, there's quite a big difference in the number of viable bacteria at 100 Celsius. And then it increases with increasing temperature. We will be starting testing in animals, but I would first like to make a mesh with essentially just more adherent iron coating, and there's a few different ways that we're looking at doing this. But I was hoping to get maybe some of y'all's input and collaborate with others that may be interested in working on this. I'll take questions.